Well, hi, everybody. I'm super excited to welcome you to today's discussion about light and how it might help your health. It is one of the most exciting advances in medicine that I have seen in my time as a doctor, my more than 20 years as a doctor. And I want to tell you a little bit about how it changed my life. And I went from being a gal who was always feeling sick, always feeling tired, couldn't exercise, to being able to engage and have more fun with my kids, go skiing, all those kind of things that you want to keep doing as you age. And what happens is too often we settle that we're just going to decline as we get older. And instead, what I want is for you to get stronger, more powerful, and come into your own as you get older. And so what's nice about this, while I am speaking to some the middle-aged people like myself, but this is for all ages. Right now, I'm using these kind of patches in all age groups. I've got a teenage friend who's using them to try and optimize their athletic performance in sports. And I have, grandparents that are using them too. So it's really something for everyone. And it's so exciting that you can do something that's way easy, quick, to make yourself feel better. So let's talk about it. How does light, okay, I'm gonna get a little bit of the doctory stuff out of the way right away. How does light affect the body? You guys know when you go out in the sun, you get vitamin D, right? Your skin makes vitamin D because of the light shining down on you. Okay. That's something most of us are familiar with. You may even have been to an office of a doctor or something like that where they put light on your skin because it's obvious that light affects the skin. Or who's gotten a tan before? Raise your hand if you've gotten a tan. Yeah. Okay, so light changes what's happening at the cellular level. And this is like a little image, kind of busy, but the idea here is light coming into a cell. It's a cell, influences the mitochondria, which makes your energy. So light can influence energy, and different wavelengths of light can turn on different kinds of genes. And that's what we want to do. We want to start to turn on the good genes, turn off the genes that are not serving us or are increasing inflammation. We want to lower inflammation and turn on younger genes. That's the whole goal here. And so how do these little patches, because there's obviously in LifeWave patches, there's not a light source. Well, so it's the light source. This is the basic idea as far as I get it, right? We put out a little bit of light, and here's a picture seeing a little bit of light coming out of the body. Well, when you put a patch on with a reflective coating, see here, patch, the light that's coming out of the body gets reflected back, and certain wavelengths are either absorbed by the patch, transmitted by the patch, or reflected by the patch. And that's how you actually get the light. You're the battery, right? Now, this is something that's my understanding of it. And there may be something deeper that's happening, but that's what they told me. And honestly, do I really worry that much about the mechanics of it? I don't, because it works for me. And so, when somebody asks me how it works, I kind of say, well, it works great. And if they want to dive a little deeper, that's fine. But the proof of the pudding is in whether or not something works for you. And, I'm willing to go it with a little bit of uncertainty about the mechanism if it's making a huge change in my life. And when that patient came in to me and said, my pain is gone from this patch, and I was kind of like, oh yeah, a little patch. And you say it's a light patch. There's no light in it, first off. And so I had to get over that idea. There's no light in the light patch. How can you be getting light? Well, so I found this and it made a little bit of sense to me. And then I thought, well, it's very safe. There's no side effects. And so what would I have to lose to try it? And that led me to put it on my little old arthritic foot. When I was in my 20s, I broke my foot, I broke my ankle. Actually, I probably broke my ankle 3 times in high school. And we never even got an x-ray. I was playing basketball. I turned the ankle over, and they just put an ACE wrap on it, right? That's okay. But later on, when I'm like 30 and my ankle is bothering me and I'm having arthritis at age 30, I took some x-rays, and the doctor's like, well, look, you've broken your ankle at least 3 times, and look at the Rock of Gibraltar that you've created from these fractures. and we'll take out the rock of Gibraltar. So he went in there and he showed me this hunk of rock that was extra, extra, but you don't want extra bones in your ankle that created from injuries before. So he took that out. He fixed up the ligaments. So I had a ligament repair. My 20s, I also had a foot fracture with like pins in it. And that doctor said, you'll never run without pain. Well, so I was thinking, I can't run anymore. I'd like to be able to run again, right? But I've been limiting myself more and more and more. And so I said, I'll try the patch. So I put the patch on my foot. And a week later, I was thinking, my foot does not hurt. I think that I could run. And, was totally worth the uncertainty of exactly how it worked. Okay. So this is a mechanism. Maybe it's not all of the mechanism, but it took away my arthritis pain. So I wasn't that worried about it. It's low risk because there's money back guarantee. For first time purchases, people have a 90-day money back guarantee. So making it really worth your time if you have low energy, poor sleep, problems with, pain, if you're not focusing. There's so many different things that light can help with. And let me tell you a little bit more about how that works. Well, so LifeWave's got a swath, a rainbow, as it were, of patches that can help you feel better. And there's one that's focused on energy, one that's focused on reducing pain. There's one to help your skin. There's one for detoxification, for mood. But of all of these awesome patches, right, whoever sent you to watch this, they can answer any questions that you have, and I can too. If you stay after this presentation, I'm happy to answer questions. So, but the one I'm really excited about, because this is the one, it took me a little while to start to use, because of course they brought me the pain patch and I wanted to have pain on. So I put the pain patch on right away and that worked. And then I started to hear about this X39 and I'm like, oh, X39. Now this sounds really interesting because for years, LifeWave's been around about 15 years, people were asking if there's any way to create a patch that could affect stem cells. And that's what it does. Patches, people have made requests to LifeWave, like what are they going to develop next? Because they've continually developed these patches, looking for something for skin and for regeneration. And that is what the X39 is. So, they did create this fabulous patch, which is what I attribute my improvement in my ability to exercise. When I first started to use the patch, of course, I couldn't run at all. So the pain went away and I thought, I can run. I still was super tired. I looked fit, but I was not fit. I was not able to exercise. And now I recently did run a half marathon, which is, I dropped the mic, unbelievable that I would be able to do that because I couldn't even jog 10 feet. So the X39 is really the patch that elevates a peptide that will activate your stem cells. And so this is what makes it different and sets it apart from the other patches. And now they have another patch called X49 that actually also elevates stem cells. So, stem cells are basically what our body can use to heal ourselves. It's like stem cells can become many different kinds of cells in your body. And it's sort of like letting a contractor go into an old house and fix up whatever has been damaged, right? We want to have that kind of flexibility. And as you get older, your stem cells go down, down. So does this copper peptide, which is called GHK-Cu. GHK goes down as you age. And LifeWave was able to show, like comparing people who had a dummy patch or had a live patch, an increase in GHK-Cu production. And this is so important, guys, because this peptide has been shown to actually turn on younger genes. Okay, so that's why we want it. We want more of that. We want it to turn on younger genes. And when you put the stem cell patch on, what happens next? Well, many people have an immediate effect. There's an increase in antioxidants, a decrease in inflammation in the body. And what we see is people have increased energy, better sleep, heal faster, wrinkles get better sports performance. Think of me in that half marathon, which is nutty crazy. Oh my gosh, banana pants crazy. A reduction in pain, which is such a gift. How often you could tell somebody like your grandmother, Grandma, try this patch. And you could make a better difference than her doctor could possibly make. because it supports the body in healing and reducing pain, activating younger genes. It's really exciting. So here are a few little, this is a month of using X39. This is over a year course. You see the change in the fine lines and wrinkles. And of course, when you're looking at the outside, this is the most obvious, but it's really about how you're feeling on the inside, right? You see an improvement in wrinkles, an improvement in the coloration. This gal here to here looks like a younger person, and heaven knows she is feeling better inside. A little bit more hair growth. Now, I'm not making, there are no medical claims here. Let me make that super clear. This is about just supporting your body to heal itself. You already have the wisdom inside you. You have the DNA. We just have to turn on the right genes to help you heal, or to help you normalize inflammation so you start to grow hair again. You know, I think of loss of hair really as an issue with inflammation and then genes that have been turned off. Let's turn the younger genes back on. If you guys are having a problem with hair, that's something that's really changed for me. Is my hair is so much different. Yeah, I used to have nothing to put in a ponytail, and now I've got a lot of hair to put in a ponytail. I mentioned that there's a new patch. Well, this is the X49. This is another stem cell patch, but this one actually focuses on physical performance, cardio health, your heart health. So helping normalize blood pressure and get your body inflammation down, and strength, stamina, power, muscle. So this is a very exciting patch. And one of the primary things that I've noticed, which I think comes from the improvement in cardiovascular system, is that I am sharper and more focused with this patch. But it has in a, little here, scar reduction with the X39. I forgot to mention that. This is really, really beautiful. So you see 2017, there's July 2018. And the difference between this and August 2018, drop the mic. Woo, holy moly, used for 1 month. This is big, you guys, okay? Okay, back to the X49. I got those slides a little bit out of order. What do we see when we use the X49 and add it to the X39? People have more ability to do things using their muscles: sit-ups, push-ups, squats, bicep curls, grip strength. Not only that, when you add these two together, we see people go farther and faster with a reduction in the stress on your heart and blood vessel system. And the way we tell about that reduction in stress is the pulse actually goes down when you're going farther and faster, which is, you know, usually if you're working harder, right, you're going to have an increase in pulse. And this is the opposite. So this is one of those reflections of a general improvement in person's cardiovascular system. This is a small study, but this is something like, you guys got to try this to see it and see what happens in your body. This is, gentlemen, this is before and after. This is 2 months of using that X49. And what we see is a drop in his fat mass, 66.6 to 59.4, an improvement in his fat-free mass, that's muscle lean mass, 109.4 up to 117.6. And most important, a drop in health risk. And when I can have somebody do kind of the same thing they're doing, just adding a little patch, and get this is a 30% reduction in his risk. That's huge. And I think that we want to recognize it's all about reducing risk and helping people to live longer and better. And these patches are available all over the world, every language. So if you have a friend in Europe, no problem, that you can get them anywhere. And there's also distribution centers all over. It's really nice. When you can give somebody a sticker, they can put it on and say, holy moly, my knee feels better than it has in years, or my back feels better than it has in years. It's big. Now, does it always happen right away? I think that's a great question that I would have. No, it does not always happen right away. My friend John, when he had his back pain, and he loves to tell the story, he put it on, didn't notice anything until 3 hours later when he was driving home. He's like, oh my gosh, my back pain is gone. He was using the IceWave patch at that time. What's important is people give it a try, and then they wait for it. You know, if it doesn't happen immediately, and with IceWave, I've had people come into my office, that's the pain patch, and they came in like supported by a family member, unable to walk because of back pain. And I put these patches on them, and they were able to walk out of the office on their own steam. And they're like, oh, what's that voodoo you just did? And, you know, I didn't have to stick a needle in them and put steroids in them, which I definitely don't like to do. I don't do that anymore because I don't think it's the best way. If we can put a sticker on somebody, have them feel better, holy moly. And also, you don't have to be a doctor to put a sticker on somebody. It's super safe, low risk, money back guaranteed. There's a lot of good reasons to give it a try. And well, what if you don't? You know, well, you know where you'll be in a month. You'll be in the same place. The pain will still be there. Maybe you'll be taking medications for it. Maybe you'll be taking pain medicine or ibuprofen, which is, you know, Tylenol, not good for your system. We really want to limit that kind of stuff, but you can make the choice not to try something new that is no risk. That's fine. I mean, some people are like, I don't want to try it. I'm not sure exactly how it works. It doesn't make sense to me. It's a little too weird to put a sticker on. That's okay. You know, I'm not, and that's your prerogative. But if you're an athlete and you're not using these, you are at a disadvantage. So if you're trying to go farther and faster, if you're trying to like up your game, you need to be using the patches. And that's the feedback that I'm getting from the high school athlete that I'm working with right now to try and help improve his PR. So because he wants to run in college. And the thing about this, of course, is that when you use these things and you want to tell people about how they're changing your life, that is a way that if you are interested, you can earn a few bucks. You could even have a full-time job. So it's as easy as telling other people about it. And it's ways that you can actually earn free patches if you are interested in that. It's super simple to do. Just tell people about it. For those of you who think, oh, I don't want to do that, probably even expensive. Well, if I told you it was 25 bucks to be a distributor, that's not too expensive, right? It's a one-time fee, 25 bucks. They give you a little website. They give you an app to use. Corporate handles everything. You don't have to buy patches. You just have to use the patches. And it's super easy. It's something that if anybody wants to, or if you know somebody that needs a job, they need help. They need support. They got to support their family. This is actually a viable option that can change lives. So just saying, we can help you. With the X39, the patches range in price depending on how many you buy, from anywhere around $77 up to, you know, retail pricing $149. Now, if you get member pricing, it's cheaper. So it's definitely worth it to be a preferred customer. And as a preferred customer, which costs 20 bucks, you can get samples of all the different patches. They'll send you a new sleeve every month of the different patches, which is great because you could try them and see if they help you, or you could give them away to people and see if they help them. So when you go to the website to purchase, just remember that that initial price you see is retail, and you got to actually click on it and put preferred customer to find out what that awesome member price is. There's a 90-day money-back guarantee for retail and preferred customers. There's a 30-day money-back guarantee, and this on first-time purchases. 30-day money-back guarantee for distributors. And by 30 days, you really actually will know. If you have a lot of chronic medical issues, I usually say 3 months, give this a 3-month try and see what happens. And you want to track what's going on. Okay. So you guys, the time is now. This is it's a beautiful company interested in helping people. And that's why I like it. This is a part-time thing for me. I'm a doc. That's my main gig. And I'm interested in helping people in as easy a fashion as possible. And there's nothing easier than putting on a sticker. So it's worth giving it a go, seeing what happens. And then if you like it, well, keep using it. Reach out to me. I'm happy to help you understand how to use the patches. You can email me, clinic@feelgoodfunctionalmed.com. Or if somebody else sent you to watch this video, I urge you to get with them. Let them answer your questions. They can connect with me and we can answer, help you understand how these might help you or someone that you love. All right, you guys, I hope this has been helpful, and I hope to see you in my email inbox, and I'll answer any questions you have. I do this regularly, and check with the person who sent you to see when my next one is. Usually it's 9:30 Monday through Friday, except for 8:30 on Thursdays. All right, see you guys. Bye.